Welcome to SimplyRN. Today we will do more ABG practice questions. If you haven't seen the ABG interpretation made easy video, please refer to the link in the description. Okay, let's begin. In our last video, we talked about before you start tackling the question, write out the normal values of an ABG and mark which side is acidosis and which side is alkalosis. And remember, CO2 is respiratory, and bicarb is metabolic. All right, let's take a look at question number 1. pH is 7.54, which is more than 7.45, so it is alkalosis. PaCO2 is 26, so that is alkalosis. HCO, 3 is 23, so that is normal. So we have pH going into alkalosis, and we also have a match in which system? The respiratory system, because CO2 is also in alkalosis. So this is respiratory alkalosis. Okay, now we have to ask ourselves, is it uncompensated, partially compensated, or fully compensated? In our last video, we talked about that if the pH is abnormal, then it is partially compensated, meaning the body is trying to compensate but not enough to reverse the abnormal pH yet. If it has completely normalized the pH, then it is fully compensated. What we didn't talk about was that it can also be uncompensated, which means the body has not done anything to reverse the acid-base imbalance, or it may not have had enough time to do so. So how can you tell if it is uncompensated? It would be uncompensated if the pH was abnormal plus the other system that is supposed to compensate was within the normal range. As in this example of respiratory alkalosis, the HCO3 is 23, which is within the normal range. If the body is trying to compensate, the kidneys will try to excrete more bicarb and retain acids. The bicarb would have been less than 22. Although we can see that it is going toward that direction, but still within the normal range of 22 to 26. So for the exam purposes, we will call this uncompensated respiratory alkalosis. Okay, let's move on to question number 2. pH is 7.31, so this is acidosis. PaCO2 is 56, so this is also acidosis. So we already know this is a respiratory acidosis because we have a match of the pH and CO2. HCO3 is 43, so it is alkalosis. And that tells us this is not uncompensated because we can tell the body is trying. So is it partially or fully compensated? Is the pH normal or abnormal? The pH is abnormal, so it is partially compensated. So far, so good, right? Let's go to question number 3. pH is 7.42, so it is normal. PaCO2 is 42. So this is also normal. This is getting interesting. HCO3 is 32, so that is alkalosis. How do we go about this? Remember from the last video, we talked about if you have a normal pH value, you need to draw a line in the middle of 7.35 and 7.45, which gives you 7.40. And look at the pH value again and see which side it is leaning toward. pH is 7.42, so it is leaning toward alkalosis, and we also have HCO3 pointing toward alkalosis. So this is a metabolic alkalosis. Is this partially compensated or fully compensated? It is fully compensated because the pH is normal. Some of you may be thinking, but the CO2 is within normal range. Wouldn't it be uncompensated? No, because the pH has been normalized, which means the body has adjusted its respiratory mechanisms to fully correct the metabolic alkalosis. So it doesn't matter whether CO2 is more than 45 or just slightly leaning toward 45, they both mean that the lungs have done a good job at retaining CO2. It would only be uncompensated if the pH is also abnormal, or more than 7.45 in this case, which means the lungs have not had a chance to retain more CO2 yet to increase the acidity of the blood. Okay, next. Question number 4. pH is 7.50, so it is alkalosis. And we already know this is either partially compensated or uncompensated because the pH is abnormal. PaCO2 is 44, so this is normal. HCO3 is 30, so this is alkalosis. So we have a match of pH and HCO3, so this is also a metabolic alkalosis, like the last question. And also like the last question, the PaCO2 is also normal. but the difference is that the pH is abnormal. So this is an uncompensated metabolic alkalosis. If the pH is normal, then it is a fully compensated metabolic alkalosis. See the difference now? And you can tell that the PaCO2 is starting to compensate because it is leaning toward acidosis, just not all the way there yet. If it made it to more than 45, then this would be a what? A partially compensated metabolic alkalosis. Okay, let's look at question number 5. pH is 7.35. PaCO2 is 48. HCO3 is 32. What do you think this is? pH is 7.35, which is normal but definitely leaning toward acidosis. PaCO2 is 48, which makes it an acidosis. So we have a match of pH and CO2 in acidosis. So this is respiratory acidosis. HCO3 is 32. So this is alkalosis. Is it partially compensated or fully compensated? Fully compensated because the pH is normal-ish, but still normal. So this is a fully compensated respiratory acidosis. All right, here is an extra question. pH is 7.55, PaCO2 is 49, HCO3 is 35. What do you think this is? Let me know in the comment what you think this is. Thank you for watching this video, and always remember, this video is for educational purposes only and not indicated for clinical use.